Raw milk is quite controversial as of late. We're hearing a lot about raw milk outbreaks with the whole H5N1 bird flu that is infecting cattle and so forth. I recently got into a little debate with a Dr. Ids over on TikTok and Instagram the other day, and I wanted to share with you a few clips of that and just talk about raw milk and some of the data on that and highlight what naysayers are saying about raw milk. And many people that are throwing shade at raw milk like to talk about this particular study that was published, I think it was 2008. This was 2012. The title of this analysis was Non-Pasteurized Dairy Products, Disease Outbreaks, and State Laws in the U.S. between the years 1993 and 2006. And I'll share with you, for example, figure 1 here. And so this was the number of outbreaks and whether or not they were attributed to pasteurized or unpasteurized milk. And as you might expect, there were greater outbreaks in unpasteurized or raw milk compared to pasteurized milk, because what happens when we pasteurize milk? Where we're heating it up and we're killing off all the beneficial bacteria as well as the potential pathogenic bacteria like E. coli, Salmonella, Listeria, and beyond. And here's this table here. This is just, there's only one table in this review paper. This table is titled, as you can hopefully see on the screen, Characteristics of Disease Outbreaks After Consumption of Dairy Products Between the Years 1993 and 2006. Okay, so what was interesting about this analysis of outbreaks and associated hospitalizations and attributed deaths to these outbreaks were whether or not the form of dairy was from fluid milk or cheese. And it was actually interesting. Under the unpasteurized raw milk category, there was 46 total outbreaks over the course of 13 years. And this is the early 2000s. And I think the prevalence of raw milk consumption is significantly higher now. You can go to Erewhon's in California, you can go to Sprouts. There's many websites and stores. In this analysis, they found that about 1% of the US population, or less than 1% of the US population, actually consumes raw or unpasteurized milk. I can't give you a number what I suspect, but I would bet large amounts of money that number is significantly higher now because of the internet, because of the whole paleo movement, and Weston A. Price movement and carnivore keto, all of that. There's many more people drinking raw milk than ever before, and that is causing a lot of people that follow mainstream medical advice to really be sort of curious about that and exercise caution. So that's why I'm making this video, because it turns out that raw milk does have risk. I will tell you that, and we can see this in the data. The hospitalization rate from an outbreak is 8% in raw milk versus just 1% in pasteurized milk. Now, what's interesting here is all of the deaths that were tracked in this analysis came actually from unpasteurized cheese. Now, what's interesting about this, in my opinion, is there's raw cheese everywhere. This is in the grocery store I go to, PCC here in Washington State. Whole Foods across the nation and even in Canada sell unpasteurized cheese as well. I even found raw cheese at Safeway, cheese made from unpasteurized milk. So it's interesting that there's so much fervor over whether or not raw milk is safe. But according to this analysis, the only deaths, and there was actually a higher percentage of hospitalizations linked with consumption of raw cheese. And so I think, if we're going to, be fear-mongering about whether or not raw dairy is safe, we should be talking about raw cheese, probably not raw milk. But that being said, again, if we look at pasteurized milk and cheese, there were only 10 outbreaks from pasteurized milk that led to 2,000 associated illnesses and 20 hospitalizations, which is the hospitalization rate is only, as I mentioned, 1% versus, I just want to throw this in there because it's actually the data, the hospitalization rate from an outbreak of unpasteurized milk was 8%. So milk is still relatively safe. And so we have one safe thing compared to a relatively less safe thing. And this is where this data goes. And this is where Dr. Ids, who I was kind of debating with on Instagram, his whole argument was the relative risk of drinking raw milk is significantly higher than pasteurized milk. He said, out of all dairy, only 1% of it is raw dairy. So that the incidence of these outbreaks is 150 times greater per unit if you're consuming raw milk versus pasteurized milk. Now, that sounds pretty scary. Like, wow, it's 150 times greater risk. But then when you look at the absolute risk of the incidence rates of hospitalization from milk per 100,000 people, it's 0.015%. So drinking milk is really, really safe. But it turns out that drinking raw milk is more dangerous than drinking drinking pasteurized milk. But again, drinking milk as a whole is very safe. So when you look at the absolute risk of drinking milk, very, very low. And the hospitalization rate, if there is an outbreak, is 8% greater when you look at unpasteurized versus pasteurized milk. And Dr. Ids didn't really seem to believe that there's any clinical benefit or advantage to drinking raw milk. And that's what we were debating on the Instagram Live. And so I just wanted to talk about that because he pointed out, rightfully so, that there's no good human data in adults ascribing health benefits linked to unpasteurized versus pasteurized milk. And to that, I will concede. I agree. There's really no good data in adults to suggest, outside of one study that was published in MDPI that I can share here. There was a 12-week study finding that drinking raw milk increased the presence of beneficial bacteria in the gut. In adults. Now, we do have fairly good data in children, suggesting that children who drink unpasteurized farm milk have a lower prevalence of atopy, asthma, and allergies compared to city-dwelling children drinking pasteurized milk. So we have decent data in children to suggest that drinking farm milk may help educate the gut immune system, and that is associated with a greater reduction in allergies and atopy. But from his perspective, there's really no good data in adults. And shortly, I will share with you what my rebuttal to that was. But first, I just want to thank you for being here. If you're enjoying the content, hit that like button. Be sure to leave a comment in the comment section below. I would love to know if you drink raw milk and what your thoughts are on raw milk. Let me know in the comment section below. And since we're going to talk shortly about muscle protein synthesis and exercise, I just want to remind you that in the new year, a great nutrient that you should be consuming around exercise is creatine. Creatine is one of the most widely studied and most effective ergogenic aids out there. What's really unique about creatine is when you take it with electrolytes around exercise, research shows you can improve your strength, performance, as well as hydration. So that's why at MYOXCIENCE, we formulated one of the only high-potency creatine products with electrolytes paired into it, along with taurine, in easy-to-use sachets, as well as a powdered drink mix that you can use before or during your exercise sessions to get more mileage, as well as support healthy hydration. There's over 1,800 reviews over at myoscience.com from people just like you using this around exercise. So if you want to get the most mileage from your workout sessions in 2025 and beyond, definitely check that out and use the code podcast at checkout. So when we were debating for 70 minutes about whether or not raw milk is healthy or not, my rebuttal to this was several-fold. I was able to do some research in preparation for this debate. It turns out that we have prehistoric archaeological evidence going back to 49,000 years, finding that humans used milk to use for art purposes. So we've been interacting with milk and cattle for at least 49,000 years. Now, it's debatable whether or not humans back then consumed the milk or they just used it in paintings. So we've been interacting with cattle and using milk, and it probably is not just cattle. It could be goats, sheep, or other ruminant animals. So we've been in contact with milk and ruminants for a very, very long time. Going back to 6,000 years, at least 6,000 years, this is when the first cave paintings of dairying started to exist in prehistoric art. So we have various cave paintings of individuals milking cows. Now, presumably they weren't milking cows for growing more vegetables. They were consuming that because, as you can see on these images here, the first sippy cup emerged in archaeological evidence with traces of bovine proteins in it about 3,500 years ago. So again, dairy, whether it's from sheep, whether it's from cattle, whether it's from goat, has been consumed by humans for a very, very long time. So usually when we see something like this throughout humanity, that a food substance, I'm not trying to glorify every single thing from the past. For example, the analogy that we talked about on the live was bloodletting. A lot of people used to believe that bloodletting would let go of the bad spirits, for example. And a lot of people, died from bloodletting because there were various theories that turned out to be incorrect about bloodletting. But there is a little bit of benefit in the context of bloodletting. For example, people that have hemochromatosis or hypercoagulable blood. For example, some patients that got severely ill with COVID-19 had increasingly high levels of blood fibrinogen, thrombotic factors, thick stagnant blood that is characterized by a high hematocrit or hemoglobin. Bloodletting may have been helpful in that context, or for men who are on testosterone replacement therapy, I often recommend donating blood. So there is some benefits to donating blood in certain contexts, but it's not a universal cure-all. Now, the main benefit, I think, to drinking unpasteurized milk would be several-fold. It's the the beneficial bacteria that you're getting from the milk. For example, the lactobacilli and bifidobacterium, as well as the protective immunoglobulins that are contained in the milk that may be altered when the milk is homogenized and pasteurized. Moreover, there's pretty good evidence to suggest that milk fat globule membrane, I know that's a tongue twister for you. If you just go into PubMed, you can search for MFGM and in milk and learn all about this. This can be a carrier for neurotropic peptides that may affect memory and mental focus and beyond, especially in young children and neonates and so forth, but it may help adults as well. And that may be adulterated or altered through the process of pasteurization. So because milk is relatively safe and raw milk is a little bit less safe than even milk, the absolute risk of getting severely ill by raw milk is not increasingly high. When you look at actually the data and statistics on foodborne illness, it turns out that the riskiest foods in terms of hospitalizations and death are attributed to fresh produce. Now, I know that's a little inconvenient to talk about. And I know a lot of people, there's many more people eating produce compared to drinking raw milk. But I think, if we're going to look at one thing and say, this thing is really bad, we should ban this, we should make it illegal, we're going to make a mountain out of a mountain hill about this, why are we ignoring the fact that fresh produce contributes to 300,000 hospitalizations every single year in the US? That's a lot. As I mentioned, between the years 1993 and 2008, 71 hospitalizations from raw milk. This is, again, over the course of 13 years, 71 hospitalizations from raw milk that have been documented. Now, this analysis says, well, there's probably many other more hospitalizations that we don't know about, and people in these rural communities that are consuming raw milk in copious amounts don't even go to the hospital because they don't have access, whatever. Look, you could say the same thing about cantaloupe and lettuce and Swiss chard and all the stuff that people are eating, right? I mean, come on. So, we have 71 documented hospitalizations from drinking raw milk between the years 1993 and 2006. Yet every single year in the US, our CDC publishes this data, 300,000 hospitalizations from fresh produce. Where's the fervor over fresh produce? There is none, of course. No one's talking about it. I think it's logically inconsistent to, really dive into the weeds and look at, hazard ratios and relative risk versus absolute risk when it comes to raw milk and just ignore the fact that 49% of all foodborne illnesses, and there's like 5 million people getting sick every year from food, 49% of those illnesses are coming from fresh produce. Now, some of the vegans will say, well, that fresh produce is contaminated from dairy, and that's why people are getting sick. But it's not all from dairy cross-contamination. It's also from human contact. People aren't washing their hands right. They're picking their nose while they're picking your strawberries, or they're going to the bathroom and then picking your cantaloupe or whatever. There is an inherent risk of all things in life, guys. Driving your car is the riskiest thing that you will do if you're under the age of 55. Statistically speaking, driving your car is the greatest cause of mortality in people under the age of 50, or I think it goes up to 55, depending upon what you look at, which data set. So driving is super dangerous, but we all drive our cars and we don't think twice about it. We don't pray before we get in the car. We don't, kiss our kids and say, oh, I hope I see you again tonight. We just drive the car, right? And so why are we freaking out about raw milk when we know that humans have been consuming it for a long time? This is, moreover, and I didn't have a chance to really talk to Dr. Ids about this, in the state of California, and I think this grocery store is probably the nicest in the world. It's known as Erewhon Market. There's one right in Hollywood, one in Venice Beach. There's one in Sherman Oaks. Maybe there's another one I'm missing here. You go out to Erewhon's in LA, especially the one in Santa Monica or Venice Beach, right in that same area. You see Maseratis, Ferraris, Bentleys, all of the people that live that are, anyone who's anyone goes to Erewhon's in LA. Like, this is like the place to go. Like, if it's more expensive, it makes Whole Foods look cheap. I mean, this is where the most expensive grocery store ever, they sell tons of raw milk and raw dairy in there and raw cheese. They don't, put this establishment in these really high rent areas to make their customers sick. They're selling this to people because people want it and they experience the health benefits from that. Now the analogy that Dr. Id said was, well, there's a lot of people that drive without seatbelts and they don't get in major car accidents. And so therefore, should we be saying that, seatbelts are stupid and we should never wear a seatbelt? No, I mean, I understand where he's going with that. But again, if raw milk was sort of like fentanyl or xylazine and causing all these people to have dysentery and listeria and distress, wouldn't we be seeing about it by now? But we're not. We're seeing many people on social media, many people highlighting benefits of drinking raw milk, right? And so I would think by now we would start to see all of this, especially in the age of the internet, right? We would start to see so many more videos and people talking about how, hey, I bought raw milk at Erewhon's Market for like $17 and now I'm sick in the hospital. Like, where are these videos? Where are people just dying in the streets or getting so sick from raw milk? There's a few isolated outbreaks here and there. And the reason why, in my opinion, we don't have really good data, comparative data to look at the health effects of raw milk versus pasteurized milk is who's going to pay for that? Because the dairy associations are very much anti-raw milk. Now you might be saying, well, why would that be? They want to promote milk. No, they don't. These are organizations that are promoting the biggest milk suppliers in the world. If everyone started getting raw milk from a local dairy or their neighbor or got a cow in their backyard, it would hurt their business. So they're very much anti-raw milk. And so I think that, again, is a little mentally, there's a lot of mental gymnastics for people saying, well, wait, these people are pro-dairy, but they're anti-raw milk. Because I think they ultimately know, and we see this with backyard chickens too. Many of the people, Tyson and all these other companies that sell chicken, they're vehemently against backyard chickens. You hear it in the media all the time. Backyard chickens are linked with all these diseases. There's one, Fortune magazine did a write-up about how backyard chickens don't save you any money, don't waste your time and all this. But many people love backyard chickens for a variety of reasons. But it seems that the power that be doesn't want you to have backyard chickens, nor do they want you to drink raw milk. And anytime that is the case, I'm a little bit curious about that. Not to weave in other unnecessary related things or straw man arguments, but we saw this throughout COVID too. People said there's no way exercise is going to help you prevent severe disease or illness. That's so stupid. What are you talking about? So there's a lot of skeptics, right, in all aspects of life. And it seems that when it comes to dairy, raw dairy in particular, even though if you go to Switzerland, if you go to France, you go to Italy, there's raw cheese and raw dairy everywhere, and people have much better health than we do here. Parts of the UK, there's raw dairy all over the place. You go to Canada, you go to Pennsylvania, the Mennonites and Amish people, pasteurized homogenized milk is not even in their vocabulary, right? These people are milking the cow and selling it at the local market or having a little buggy on the side of the road and they go sell it, to their neighbor or whatnot. So there's a lot of people consuming raw milk, and it turns out it can be risky, based upon the data. And I just want to be very intellectually honest with you here. They say the incidence in our analysis suggests that non-pasteurized dairy was linked with 150 times greater per unit of dairy consumed compared to the incidence of pasteurized products. So technically, it's riskier, right? So if you're really, really, really concerned about never ever getting sick and minimizing illness and so forth, then yeah, you probably shouldn't be consuming raw milk. But if you want to borrow some of the beneficial bacteria that cattle are garnering or offering to you when you consume raw milk, or in the case of my daughter, we started getting her on raw goat's milk when she was 6 months old. She's now 12 years old. Never once gotten sick. I've been consuming from milk. She's gotten sick, of course, but not from raw milk. I started consuming raw milk in 2007 in Colorado, so we're coming up on like 17 years. Never gotten sick from raw dairy. Now, I know that people in the comments are going to say, "See, you're very anecdotal and things like that." But again, if it's that dangerous, don't you think by now I would have gotten sick, or my daughter would have gotten sick, or many other people that have been consuming raw milk their entire life? Like, wouldn't they have gotten sick by now from this, or really, really ill? Sprouts in California, major chain all throughout California and Arizona. They sell raw milk all day long, tons of it with Erewhon's, and there's raw cheese in Whole Foods and Safeway. Like, why are these major companies? They're in the business of helping their customers. It turns out that when you provide a beneficial item for your customers, you get repeat business. If you make people sick, you don't get customers coming back. You get negative reviews. So I don't understand why Erewhon's and Sprouts and Whole Foods and natural food stores would sell these products and continue to sell them, and people continue to buy them if they're that risky. I mean, that's just like common sense. So Dr. Ids really concluded with, hey, it seems like you make decisions based upon a lot of anecdotes and historical evidence. And I said, yeah, that's actually, I see where you're going with that. And he had a good question that I didn't have an answer for. How much evidence do you need to decide whether or not something is safe or not? And I said, well, it's sort of a combination of a lot of things, doctor. I said, when we look at the historical data, people have been consuming raw milk, as I mentioned, for at least 6,000 years. I've been doing it for a very long time. I know a lot of people that also do this. I know many grocery stores that routinely sell this. We have some data in kids to show it's beneficial. I'm willing to take that risk because I feel that the benefits are better than the pasteurized versions. I mean, you can't really make yogurt at home from pasteurized milk or kefir. I mean, you can try, and I've tried that, and it doesn't work. And that leads me to think that the heating and homogenization process just renders this just a dearth of beneficial bacteria, which are why we're consuming these foods for that. Now, he countered to that and said, well, why don't you just supplement with probiotics? I'm like, well, there's something about the food matrix. And I have a piece of data here. There's actually research about highlighting the food matrix. And this is a study. This is a narrative review that was recently published in an article known as Critical Reviews in Food Science and Nutrition, titled The Food Matrix, Implications in Processing, Nutrition, and Health. And it turns out that, for example, if you have a whole carrot, it affects your glycemic levels compared to drinking just carrot juice, right? And so the idea that we can sort of modify a food and then say, well, it's the same thing, right? Well, it's kind of not, because there is this idea of the food matrix, and this is not a conspiracy theory. This is not woo-woo stuff. There's really good, pretty good evidence to suggest that when we adulterate foods, just common sense will tell you that the canned eggs are probably not as healthy as just cracking the eggs from your backyard chickens, right? They might have similar protein content, but there's going to be a difference. You need to have preservatives in there. They're usually irradiated. All these things. So, my argument to him was like, look, the more that we get closer to our food and we don't adulterate our food and industrialize and process our food, the healthier it is. That's just my perspective. And so I'm willing to take the risk, even if it's 150 times greater to consume raw milk, because I've been doing this a very long time and have had no issues. I've even drinking raw milk past its expiration date and I've had no issues several times in a pinch. That's not to say that you should. This is just what I do. I take care of my health and my body. I think you should as well. So if you're, like a bubble person, and need hand sanitizer to leave your house, then maybe you just get the pasteurized milk. At least get pasteurized whole milk, not the 1% or 2% milk. So I'm kind of rambling here. I would love to know what you think in the comment section below, my friends. Thank you as always for tuning all the way through. If you enjoyed this video, please hit that like button. If you enjoy raw milk, let me know in the comment section. We'll catch you in a future one down the road.